Once you make a decision that you need to have a transplantation, every day is super important for them. We have one of the fastest transplanting programs in the country. It's part of the trick of how we are such a different program. We are very aggressive trying to find organs. We very carefully review every offer, and if we see that they can work for them and it's a good quality organ, we fly to multiple places to pick up organs.
You know, the mission is to save these people's lives and to try and get them through surgeries that often are possible, but people shy away from them because they're either too complex or they don't have the appropriate team to do them.
Michael Serke, I'm 40 years old, from Shelton, Connecticut. Back in December of 2021, I got COVID. It ended up being a pretty severe case. Within a couple days, I realized I had some trouble breathing, and I called the ambulance to go to the hospital. Within a few days, they transferred me to the ICU. Within a week and a half, I was put on a ventilator. I was in medically induced coma for a period of roughly 5 months, where I don't remember any of that at all. Prior to COVID, I didn't have any medical complications. Just had the normal life of could do anything. Ran a few half marathons over the years. Was pretty active outside with kids. Worked full time, and everything was going well.
When he went in, there were still COVID restrictions in the hospital, so I actually couldn't visit him for 9 weeks. The day that they opened visitation, I ran down there. He had tubes in his nose and in his mouth. Obviously, nobody wants to see any loved one in that predicament.
At that time, very few institutions were considering doing transplantation, and we were one of those institutions. So they called me, they described that they have this young patient that has been for months now in the ICU, and see we will consider doing a lung transplant for them.
His presence was so calming, and he just seemed so confident, and he was so friendly.
Talking with Dr. Angel, he definitely instilled some hope in me that there was going to be a solution to this, and one day I would be able to get out of the hospital, go home, see my family and my kids. It was pretty tough to do anything.
They called me and said, I think that we are in a bad situation now because he is so short of breath that he cannot walk. Then we kind of knew that at that point the only option was going to be a transplantation.
They had arranged to have me transported down to the hospital for a fast-track assessment through the lung transplant program.
My best day was actually the day he went to NYU. And I say that because, not only because he was, going to Dr. Angel and somebody we already met, but at that point it was, okay, we know this is what we need to do. We know he needs a lung transplant. I just felt relief because I knew he would be in the best hands with Dr. Angel and his team.
On top of the respiratory failure, he has what we call an abnormal liver test. So we consulted our liver team.
His bile ducts in his liver had taken some damage from COVID, and that his liver wouldn't sustain a lung transplant on its own. So we decided to do it as a combined procedure.
We are very comfortable doing these multiple transplants because of the experience of our teams. We feel that we have to be offering these procedures to the sickest patients, and that we shouldn't walk away from anybody that needs this procedure.
Addie's gonna have some surgery later. She's gonna get new lungs tonight.
Tonight?
Yeah.
After about 10 months, I was able to finally breathe on my own after the surgery and not feel like I was drowning underwater.
It just was this whole story that we just went through up and down.
How does it feel to have him home now?
I'm really grateful, and I just love having him home. It wasn't the same before.
I don't think there's a better job. You see someone who's basically dying, he can't get out of the hospital, he's on machines, and you do these surgeries, and now he's living a normal life.
We have a level of passion that is second to none in taking care of our patients, and that's the reason that we have the best outcomes and the best results.
It's amazing he's home. I mean, I wasn't sure we'd get here. New lungs and organs and livers and everything, but he's sitting here with me and the kids, and everyone has their own specialty, and lung transplant is NYU Langone's.